Hi, I'm Kerry Jackson from the International Medicine Clinic at Harborview, and I'm going to talk to you about a new technology. The use of video interpreting is a midway step between the presence of having an in-person interpreter, which is, we all know, is very helpful, and the use of telephonic interpreting, which actually enables us to spread interpreting resources around the community in a more efficient manner. It's not without its drawbacks, and for that you'll have to learn to manage the camera and manage your position, manage visual contact, and the audio component. But if you do that, I think that it will be far superior to telephonic interpreting and at the same time facilitate your encounter the way that an in-person interpreter can.
Patients and staff at Harborview come from around the world with a wide variety of cultures and languages.
Just follow me down here. You got this room.
In order for health providers and patients to communicate effectively, we work with interpreters to make sure we give the best and most appropriate care. Our state-of-the-art remote interpreting system makes that process more efficient, and that means better patient care.
The doctor will be in with you in a moment.
The portable units are used in exam rooms. Each cart has a computer and a video camera.
Hello, Violeta. How are you?
Hola, doctor.
Nice to see you again. Should we get an interpreter today?
Sí, por favor.
Okay.
When a physician is ready to examine his patient, he calls the Harborview interpreter's office.
Hi, Rosa. It's Dr. Morris from Family Medicine. I need a Spanish interpreter today.
The doctor calls the interpreter's office and asks for an interpreter who speaks the same language as his patient. The interpreter answers from a private booth in an office at Harborview. No one else in the interpreter's office can hear this conversation or see the video screen.
Good afternoon. This is Rosa Villalobos, and I will be interpreting for you today. May I have your location, please?
Family Medicine.
May I have the patient's name and Harborview record number?
Sure.
The interpreter asks for the patient's name and Harborview record number. This information is used to assist in scheduling interpreters and to keep track of the number of requests.
Yes, and may I have your name and contact information in case we get disconnected?
No personal information about the patient will be recorded by the interpreter during this session, either on the computer or in written notes. In fact, the video unit has no recording capability at all. It can only transmit sounds and the images between the exam room and the interpreter's office.
I want to take a moment to explain the hand signal that I will use in case I need to interrupt you to explain or clarify a point. So I will be doing this, okay?
Okay.
I will also use the same hand signal in case you have been talking for too long and I begin to get concerned about forgetting the information. And I will also interrupt in case I need to explain a cultural element.
Okay. Great.
Okay?
Great.
And now I'm going to explain to the patient the same thing, and then we can begin.
Okay.
Buenas tardes, señora Rodríguez.
Buenas tardes.
Mi nombre es Rosa Villalobos, yo voy a ser su intérprete. Le voy a enseñar la señal que voy a usar en caso de que sea necesario interrumpir para explicar o clarificar algo. Voy a usar esta señal, ¿ok?
The pre-session you've just seen is important so that the interpreter can set up optimal conditions for seeing and hearing the patient and doctor. It may be necessary to ask the doctor to adjust the blinds if there is glare, or adjust the position of the unit for best picture. Once the session starts, it will be the same as if the interpreter were in the exam room in person.
Gracias. Thank you, doctor. Go ahead.
Okay, great. Hi, Violeta. Nice to see you today.
Hola, Violeta. Mucho gusto verla ahora. It's a pleasure.
Okay. Well, what would you like to work on today?
¿En qué le gustaría trabajar hoy?
Me gustaría hablar sobre mi diabetes.
Okay.
I would like to talk about my diabetes.
Okay. Great, great.
Muy
Well, we prescribed a new medication the last time. How did that go for you?
La última vez que usted estuvo aquí le recetamos un medicamento nuevo. ¿Cómo le fue con eso?
Muy bien.
Very well.
Sí, me fue muy bien. Esto...
Yes, it went very well.
Sí, y noto que me siento mejor.
Yes, and I've noticed that I feel better.
Oh, great. Is it okay if I listen to your heart and lungs today?
¿Está bien si escucho su corazón y sus pulmones? Yes, please.
Okay, great. I'm just going to move the video out of the way.
Entonces voy a mover el video.
During the physical exam, the card is turned so that the interpreter can still talk to the patient and doctor without seeing what is going on.
Let me take a listen to your heart first.
Voy a escuchar su corazón primero.
Okay, you just breathe normally.
Respire normal.
Great, your heart and lungs sound really good.
Muy bien. Su corazón y sus pulmones se escuchan muy bien.
Okay, great. Let me go ahead and pull
Muy
the
bien.
video back here so we can see her.
After the physical exam, the cart can be turned back so that the patient and doctor can see their interpreter again.
Great. Well, it sounds like things have been going really well for your diabetes.
Parece ser que le está yendo muy bien con su diabetes.
Do you have any other questions?
¿Tiene alguna otra pregunta?
No importa que está un poquito más al 120 que más.
It doesn't matter that it's a little bit more towards 120.
Yeah, no, I think it's right where we
No.
want it. It's right in the perfect.
No, yo pienso que está donde nosotros queremos que esté.
Ah, perfecto. Entonces.
Okay.
Okay, perfect.
Would you like to come back in about 4 or 6 weeks?
¿Gustaría regresar en 4 o 6 semanas?
Sí, perfecto.
Okay, great.
Yes, perfect.
Okay,
Muy
well,
bien.
keep up the good work.
Entonces mantenga el buen trabajo.
Oh, gracias.
Okay, great.
Thank you very much.
Great, and thank you for your help today.
Thank you.
Adiós,
señora.
señorita. Adiós.
40 years ago, Ms. Ruth Ritter, who was a chief nurse on the neurology ward, would hire her new people with a language such that her patients never had to worry about being unable to speak to someone who could understand them. About that time, the crisis in Southeast Asia occurred, and we suddenly had an influx of people who needed help and succor and also needed medical care but couldn't speak English. Suddenly followed by another large group of people who came from south of the border, followed by yet another group of people who came from the Horn of Africa and other places. Now there are 80 plus languages that are spoken in this hospital, 20 inside the hospital in any given day. We can't do medicine without the translators. It's impossible to see a patient in a clinic without having some help with another voice. It's impossible to see a patient in the emergency room without help from another voice. So translation has allowed us to be good doctors, and in reality it's helped us become better doctors. Better providers of care, better understanding of the people and the culture from which they came. Medicine without translation at Harborview is almost impossible to consider now.